All right, good morning, and thank you to everyone for joining us today. We appreciate that you're taking the time to be here first thing this morning. But before we get started, I just want to take a moment to acknowledge the terrible situation unfolding in the Ukraine right now. Our hearts are with the Ukrainian people, and we are grateful to the journalists who are putting themselves in harm's way to tell the world what's going on there. I'm sure many of us woke up to that news this morning. And we are going to, today we are going to do our best to keep our job focused on making Michigan a better state by working on policies that matter here. But I didn't want to get started today without acknowledging that we woke up to a different world this morning, and our thoughts are certainly with the sizable Ukrainian population right here in Michigan as well. So good morning, and thank you all for being here. My name is Senator Winnie Brinks, and I am the Democratic Vice Chair of the Senate Health Policy and Human Services Committee. Today I'm joined by colleagues in the House and Senate who are working toward lowering the cost of prescription drugs and increasing the transparency in the price setting of those drugs. We all know that prescription drug prices have been on the rise for quite some time. And the simple fact of the matter is, prescription drugs are useless if patients cannot afford them. This bicameral effort that we're announcing today would create a prescription drug affordability board that operates similarly to the Michigan Public Service Commission, as well as a prescription drug affordability stakeholder council that reports to this board. The independent board of experts appointed by the governor would research, review, and establish limits on the most expensive prescription drugs used in our state, price limits. After this research, the board would then create a report and have the authority to cap upper payment limit costs. And like any public body, such as the legislature, the public would be able to weigh in and provide comments. Having such an authority in place can immediately affect the cost of prescription drugs, putting money back into the pockets of Michiganders at the point of sale. This is not a new concept. 10 other states, including fellow Midwestern states like Ohio and Minnesota, already have some form of authority that can limit how much consumers are paying for prescription drugs. And with the state of Maryland is perhaps the furthest along in this matter, and they are leading the way. This legislation offers a chance for everyone in the prescription drug industry to have a role and to state their best case for why a particular drug is priced the way it is, or alternatively, why it shouldn't be priced in that manner. These bills are good steps toward lowering the price of prescription drugs so that Michiganders are not forced to choose between paying for their life-saving medications or putting food on the table. And so I thank my colleagues for their work on this important issue. Now, for further explanation of the impact that this kind of authority can have, I'm going to hand it over to Dr. Harshini Jayasuriya.
Thank you, Senator Brinks. My name is Dr. Harshini Jayasuriya, and I am the owner and worker of Bridge Care Specialists of Michigan and a member of the Committee to Protect Healthcare. More Michiganders are struggling to pay for their health care, including the drugs prescribed to manage heart disease, asthma, diabetes, and many more illnesses everyday residents suffer from. Physicians know that the medications we prescribe will improve the health of a patient and potentially save their lives. Yet costs remain a major barrier in patients obtaining these needed medications. In my years as a family physician, I've sadly seen this story play out too many times. A patient coming in after rationing their medication or even skipping it altogether, meaning that their health condition I've tried to help them manage has become worse. For Michiganders who are uninsured and underinsured, the impact is only greater. Too many people are forced to let otherwise manageable conditions worsen, to let treatable diseases progress, because there is no way they can afford a prescription even with health insurance, let alone without it. In my current work, the need for affordable prescription drugs remains clear. I help patients who are recovering after a stay in the hospital or in a rehab before they can connect with their primary care doctors. Our goal is to try to prevent readmissions, and oftentimes these readmissions are caused by the simple fact that they aren't able to afford their medications. It is critical for my patients to be able to access the medications I prescribe to ensure that they don't end up back in the hospital or rehab with more hospital bills and higher costs for the state. These patients shouldn't have to choose between the medicines they need and paying for other bills and groceries and rent. Michiganders need real relief, and I applaud this group of lawmakers for tackling prescription drug affordability head-on. Now I'd like to turn it over to Sheila Nichols, a resident of Okemos, Michigan.
Good morning. My name is Sheila Nichols, and I am a resident of Okemos. My story on the effect of prescription drug costs begins about 4.5 years ago, when I had a major heart attack that first required a double bypass and eventually resulted in a mitral valve replacement. As you can imagine, I'm now on heavy-duty heart medication, as well as medications for high blood pressure and osteoporosis. Then, about 2 years ago, my husband was diagnosed with Parkinson's disease, so he is on medication for that, as well as blood pressure too. We are retired, and while we are fortunate enough to have insurance like many, it is not without its trade-offs. Our healthcare plan also changed about 2 years ago, and now we pay a higher deductible. The thing is, prescription drugs are not the only costs that are rising for us and many other Americans. Doctor visits also, as well as groceries, gas, and so forth. I'm 75, and I don't expect to see a radical shift in the industry that we've come to know as healthcare anytime soon. So I think the legislation being offered today is important because of the way it works with the existing system. This would be a major help to those of us living on fixed incomes, and it surely would help reduce out-of-pocket costs for folks who don't have prescription drug coverage and who are currently paying full price. Our prescriptions are necessary for the well-being of myself and my husband, as well as millions of others who rely on them. Thank you so much, and now I turn it over to Representative Darren Camilleri for more.
Thank you, Sheila, and good morning, everybody. I'm Darren Kimmeler, and I represent House District 23 in the Michigan House, many communities in part of downriver. As speakers before me have outlined, we have spent far too long accepting the fact that prescription drugs are critical to a person's health. They're just simply way too expensive. However, the price of prescription drugs is outpacing the rate of inflation. There are so many families and vulnerable populations who rely on prescription drugs to carry on in an already chaotic time of this pandemic. Forcing them to choose between staying safe and healthy or paying the utility bill, the rent, or the grocery bills is simply inhumane. We live in a country full of innovation and promise in healthcare, but with that comes a responsibility to our residents to be able to participate in that system. That system currently is terribly complex, and unfortunately what goes into drug pricing is just as bad, if not worse. So I'm honored to stand here today to support these and other bicameral efforts to lower the costs of prescription drugs. As you all may be aware, we've already passed some legislation related to prescription drug pricing. So I will note that what is unique and different about this particular package is that it directly lowers the cost of certain prescription drugs at the point of sale. By encouraging integrity in the process of price setting, we get to the results a little bit faster. Of course, as I've mentioned, this industry is complex and there's a lot of work to still be done. I think I speak for all of us when I say we are looking forward to being part of the multifaceted effort to drive costs down, because anything less is unacceptable. With that, I'm going to turn it back over to our press secretary, Rosie Jones, and I think we'll head into some questions from the press. Thank you all so much for being here.